Your medicine cabinet has quickly become the newest drug dealer, let's say in some households. We won't make it your household. But parents, it's something you need to know about. We've talked about prescription drug abuse for a while in teens, but it's still a problem.
It sure is. In fact, it's gone up in this country 33% over the past 5 years. Dr.
Wow.
Jennifer Caudle is here. Dr. Jen, thank you for coming in.
Thanks for having me.
We talk and talk and talk about it, and it's still on the rise. Just kids going into their parents' medicine cabinet.
Well, you know, you bring up a really great point. We know that people who abuse prescription medications most commonly get them from friends and family. So the medicine cabinet can absolutely be a problem here.
And then I'm reading, too, that a lot of teens are trading prescription drugs amongst each other. So, you know, somebody else has Ritalin or Adderall, and they're trading it around.
It's called farming, right?
Yes, this is a growing trend that's actually very dangerous. It's absolutely an epidemic. A recent study showed that 1 in 4 teens admitted to abusing prescription medications for the purposes of getting high or changing their mood. Now, this is huge, and what this means is that these medications, prescription medications, if they're not intended for you, you need to proceed with caution and know the risks.
Okay, doctor, I want to know if my teen is using my pills, what would I see in their behavior?
Well, first thing parents need to do is they need to talk to their kids. Studies show that parents really talk to their kids about drugs and alcohol, but usually street drugs. We often leave out the prescription medications. First thing parents need to do is you need to talk about those prescription medications that are often abused. The pain meds, the Ritalins, the benzos like Xanax. But the other thing parents need to do is pay attention to your kids, okay? Signs that you might be able to notice: changes in behavior. If all of a sudden your child has a drastic personality change that doesn't seem to make sense, you really need to look closer.
The grades go down, stuff like that.
Absolutely.
Yeah.
Makes sense. I think sometimes, you know, and I even hesitated in the intro to your, to the segment saying, you know, parents, your teen could be getting into your medicine cabinet because you never want to think that it's your child.
Absolutely. And, well, this is with all substance abuse, right? And that's why we all have to talk to our kids and to other people. Prescription medications are used for good reason when under a doctor's care and for a specific prescription purpose. The problem is when they get into other hands. So if you're actually using these medications under a doctor's care, you need to treat them like a valuable. Lock them up. Keep them safe.
It's interesting, sorry to interrupt. Around the country, this Saturday is known as National Prescription Drug Take-Back Day. Can you talk a little bit about that?
Absolutely. Well, there's lots of ways to discard of your medication. So if you are on prescription medications and you need to discard of them for any reason, there are specific guidelines you need to follow. First of all, follow the directions that are on the label, okay? The second thing that you can do is that there are these prescription take-back days throughout the country where it's a regulated way to dispose of your prescription pain medications. You can go to the DA website and they'll give you more information to do that.
Doctor, fantastic job again.
Thanks so much.